Abdominal CT scan. What does the examination entail? Computed tomography, CT, scans comprise imagery produced by a specialized X-ray apparatus. This apparatus circumnavigates your physique, capturing visual data from all angles within its orbit. The machinery quantifies alterations in the X-ray beams as they traverse your form, subsequently transmitting this data to a computational system. Here, it crafts a compendium of monochromatic depictions, each portraying a subtly distinct stratum or cross-segment of your internal anatomical structures. Given that these strata are spaced approximately 1/4 of an inch apart, they furnish a remarkably faithful representation of your internal organs and ancillary formations. Medical practitioners employ CT scans for the comprehensive scrutiny of all primary corporeal regions, encompassing the abdomen, dorsal area, thoracic cavity, and cranium. A CT scan proves especially adept at observing the visceral contents of your abdominal cavity. It excels in scrutinizing robust organs, including the hepatic, pancreatic, splenic, renal, and adrenal entities. Additionally, it offers exceptional visibility of the expansive vascular conduits traversing the abdominal domain, the aorta and vena cava, as well as the localization of lymph nodes therein. Organs that possess mutable configurations contingent on their repletion, such as the stomach and intestines, pose a greater challenge for the CT scan's precise evaluation. This challenge arises from the occasional difficulty in unequivocally ascertaining their normalcy. Nonetheless, Connecticut scans frequently furnish valuable insights into the state of these organs. Abdominal CT scans are frequently requisitioned for the detection of signs indicating inflammation or infection within various abdominal organs, the identification of neoplastic growths, or the diagnosis of injuries affecting one or more internal organs. What preparations are necessary for the procedure? Should you anticipate the administration of intravenous, 4, contrast dye during your diagnostic session, it is judicious to undergo a renal function assessment before the examination. A test performed within the preceding 6 months may suffice in this regard. Individuals prescribed the antidiabetic medication metformin, glucophage, should discontinue its use several days before a CT scan employing contrast agents. For individuals undergoing abdominal CT scans, fasting for a duration of 2 to 4 hours prior to the examination may be mandated. Additionally, you may be required to consume a copious amount of oral contrast, a fluid compound that imparts visibility on the CT images and demarcates the linings of certain internal organs. It is imperative to apprise your healthcare provider if you possess hypersensitivity to X-ray contrast agents, are in a potentially gravid state, or have diabetes, especially if insulin dependent, as insulin administration in the absence of a meal can precipitate hypoglycemia. What transpires during the execution of the procedure? The examination is conducted within the radiology department of a medical facility or a diagnostic clinic. You will be garbed in a hospital gown and recline supinely upon a table that is amenable to horizontal displacement through the annular CT device. In cases necessitating the use of contrast dye, an adept technician or healthcare professional may establish intravenous access and instill the contrast agent. This dye delineates blood vessels and soft tissue, facilitating their delineation on the resultant images. A technologist, situated within an adjacent chamber, manipulates the table via remote control to facilitate the comprehensive scanning of your physique from multiple vantages. Upon each alteration of the scanning plane, you may be instructed to briefly suspend respiration. The technologist typically orchestrates these movements while monitoring your progress through a window and, at times, communicating via an intercom system. A standard CT scan consumes approximately 15 to 20 minutes. Are there any potential hazards associated with the procedure? Several potential risks warrant consideration. The contrast dye utilized in the procedure carries the potential to inflict harm upon renal function, particularly in cases of pre-existing renal impairment. It is important to note that such renal impairment, if induced, is typically transient. Individuals with a hypersensitivity to the contrast agent may manifest cutaneous eruptions or experience a precipitous decline in blood pressure, potentially culminating in syncope, until prompt medical intervention is administered. Analogous to conventional X-ray procedures, CT scans entail exposure to ionizing radiation. The magnitude of radiation exposure associated with CT scans surpasses that of standard X-rays, yet it remains insufficient to pose a substantial risk, except in instances involving pregnancy. Is there any post-procedural protocol to be observed? Following the completion of the examination, your attending physician may recommend a subsequent evaluation of renal Function if contrast was administered and you possess a medical history indicative of renal impairment. What is the anticipated turnaround time for receiving test results? The radiologist is typically capable of furnishing preliminary findings within the span of a day. The formal interpretation of your CT scan may necessitate an additional day for comprehensive analysis. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.